Question 1. When evaluating a client's readiness to transition from an inpatient rehabilitation program to a less intensive level of care, which of the following approaches best reflects current best practices in addiction counseling? Option A. Releasing the client to an outpatient program without discussing their aftercare options or involving them in the development of their transition plan. Option B. Discharging the client to an outpatient program solely because they have completed the standard duration of the inpatient stay, regardless of their individual progress or demonstrated coping skills. Option C. Suggesting the client return to inpatient care if they express any concerns about their ability to manage cravings after discharge, without a thorough assessment of their relapse prevention plan. Option D. Recommending a structured outpatient program that includes regular individual counseling sessions, participation in a 12-step facilitation group, and scheduled check-ins with a case manager, based on a comprehensive assessment of the client's progress, risk factors, and support system. Correct answer is D. Recommending a structured outpatient program that includes regular individual counseling sessions, participation in a 12-step facilitation group, and scheduled check-ins with a case manager, based on a comprehensive assessment of the client's progress, risk factors, and support system. Explanation. This scenario presents a common challenge in addiction counseling, determining the most appropriate level of care for a client transitioning from inpatient treatment. The professional must balance the client's immediate needs with the long-term goal of sustained recovery, adhering to established best practices and ethical guidelines for client care. The challenge lies in accurately assessing the client's readiness for a less intensive modality and identifying potential risk factors for relapse. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment of the client's progress, risk factors, and support systems. This aligns with the IC and RC ADC exam's emphasis on evidence-based practices and client-centered care. Specifically, it reflects the understanding that successful transition from inpatient care requires careful consideration of the client's engagement in treatment, development of coping skills, and the availability of robust aftercare support. This approach ensures that the client receives the appropriate level of support to maintain sobriety and prevent relapse, thereby upholding the counselor's ethical responsibility to promote client well-being. An incorrect approach that focuses solely on the duration of inpatient treatment, without considering the client's individual progress and readiness, for a less intensive setting fails to meet the standards of individualized care. This could lead to premature discharge to an inappropriate level of care, increasing the risk of relapse and violating the ethical principle of beneficence. Another incorrect approach that neglects to involve the client in the decision-making process regarding their aftercare plan undermines client autonomy and self-efficacy, which are crucial for long-term recovery. This also fails to adhere to ethical guidelines that promote collaborative treatment planning. An approach that solely relies on the availability of outpatient services without a thorough assessment of the client's specific needs and potential barriers to attendance would be professionally unsound, potentially leading to a mismatch in care that could jeopardize the client's recovery. The professional decision-making process should involve a systematic evaluation of the client's treatment progress, including their participation in therapy, development of relapse prevention strategies, and demonstration of stable functioning in a structured environment. This assessment should be collaborative, involving the client in setting goals and identifying preferred aftercare options. Counselors must also consider the availability and suitability of various aftercare services, such as support groups, individual therapy, and case management, to create a comprehensive and effective transition plan. Adherence to ethical codes and regulatory frameworks, which emphasize client welfare, informed consent, and evidence-based practice, is paramount throughout this process. Question 2. Strategic planning requires a substance use disorder counselor to consider how to respond when a client, diagnosed with a severe alcohol use disorder according to DSM-5 criteria, discloses past behaviors that involved significant harm to others during periods of intoxication. The counselor must determine the most ethical and legally sound course of action. Which of the following represents the most appropriate initial step? Option A. Immediately report the client's past disclosures to law enforcement and relevant authorities, as the severity of the past harm necessitates immediate intervention. Option B. Continue with the current treatment plan without further inquiry, as the disclosures pertain to past events, and the client is now engaged in therapy. Option C. Advise the client that their disclosures will be reported to the authorities due to the nature of the harm caused, potentially impacting the therapeutic alliance. Option D. Conduct a thorough risk assessment to determine if there is a current and imminent danger to others, and consult with a supervisor or ethics committee regarding the findings and appropriate next steps. The correct answer is D. Conduct a thorough risk assessment to determine if there is a current and imminent danger to others, and consult with a supervisor or ethics committee regarding the findings and appropriate next steps. Explanation. This scenario presents a professional challenge because the counselor is faced with conflicting ethical obligations, maintaining client confidentiality and ensuring the safety of others. The counselor must navigate the complexities of the DSM-5 criteria for substance use disorders, while adhering to the ethical codes and legal mandates governing their practice. The client's disclosure of past behaviors, while potentially indicative of a severe substance use disorder, also raises concerns about potential ongoing risks. Careful judgment is required to balance the client's right to privacy with the duty to protect. The correct approach involves a thorough assessment of the client's current risk to others, guided by the DSM-5 criteria for substance use disorders, and then consulting with a supervisor or ethics committee. This approach prioritizes client well-being and safety while upholding professional standards. It acknowledges the severity of potential risks without immediately breaching confidentiality. Consulting with a supervisor or ethics committee provides an objective perspective and ensures adherence to established ethical guidelines and legal requirements, such as those outlined by IC and RC. This process allows for a nuanced decision that considers all factors, including the client's progress, the nature of the past behaviors, and the likelihood of recurrence. An incorrect approach would be to immediately report the client's past behaviors to law enforcement or relevant authorities without a current assessment of risk. This breaches client confidentiality without sufficient justification under the duty to warn or protect, as defined by relevant regulations and ethical codes. Another incorrect approach would be to ignore the disclosure and continue treatment without further investigation or consultation, as this could endanger others if the risk is indeed current and significant. Failing to consult with a supervisor or ethics committee when faced with such a dilemma is also a professional failure, as it bypasses a crucial mechanism for ensuring ethical and legal compliance. Professionals should employ a decision-making framework that begins with a comprehensive assessment of the client's current situation, utilizing diagnostic criteria like those in the DSM-5. This assessment should focus on identifying any imminent danger to self or others. If such a danger is identified, the next step is to consult with a supervisor or ethics committee to determine the appropriate course of action, which may include breaching confidentiality in a legally and ethically permissible manner. Throughout this process, documentation of all assessments, consultations, and decisions is critical. Question 3. Market research demonstrates that evidence-based practices in addiction treatment are continually evolving, with new therapeutic modalities and a deeper understanding of neurobiology emerging regularly. A certified alcohol and drug counselor, ADC, has been practicing for 15 years, relying primarily on the knowledge and skills acquired during their initial certification and subsequent, infrequent workshops. The counselor is aware that the field is changing, but has not actively sought out new training in the last 5 years, believing their experience is sufficient. Which of the following represents the most professionally responsible and ethically sound approach to maintaining competence in this evolving field? Option A. Continue to rely on extensive clinical experience, assuming that foundational principles of addiction counseling remain constant and sufficient for effective practice. Option B. Attend a broad range of workshops and conferences, regardless of direct relevance to current practice, to accumulate the required continuing education hours. Option C. Proactively identify areas of practice where new research or modalities have emerged and seek out relevant continuing education and training to update knowledge and skills. Option D. Focus solely on advanced clinical supervision, believing that peer feedback will adequately address any knowledge gaps without the need for formal continuing education. The correct answer is C. Proactively identify areas of practice where new research or modalities have emerged and seek out relevant continuing education and training to update knowledge and skills. Explanation. This scenario presents a professional challenge rooted in the dynamic nature of the addiction counseling field and the ethical imperative to maintain up-to-date knowledge and skills. Counselors are ethically and often legally obligated to provide evidence-based and effective treatment. The rapid evolution of research, treatment modalities, and understanding of co-occurring disorders necessitates ongoing learning. The IC and RC ADC exam preparation framework emphasizes the importance of professional competence, which is directly linked to continuing education. The correct approach represents best professional practice because it demonstrates a commitment to lifelong learning and the proactive pursuit of knowledge relevant to the counselor's practice. By seeking out training in areas where their knowledge may be less current or where new best practices have emerged, the counselor ensures they are providing the most effective and ethical care possible. This aligns with the core principles of professional responsibility and client welfare, as mandated by professional codes of ethics and regulatory bodies that underpin the IC and RC standards. Staying current is not merely a recommendation. It is a fundamental aspect of maintaining licensure and providing competent services. An incorrect approach that involves relying solely on past training and experience without seeking new knowledge is professionally unacceptable. This failure constitutes a breach of professional competence and can lead to the provision of outdated or ineffective treatment, potentially harming clients. It also violates the spirit and often the letter of continuing education requirements, which are designed to prevent such stagnation. Another incorrect approach, such as attending training that is not relevant to the counselor's scope of practice or client population, is also professionally unsound. While it might fulfill a numerical requirement for hours, it does not contribute to enhanced competence in the areas where it is needed, thus failing to uphold the duty of care. Finally, neglecting to document continuing education activities is a regulatory and ethical failure. Proper documentation is essential for demonstrating compliance with licensing board requirements and for professional accountability. The professional decision-making process for similar situations should involve a self-assessment of current knowledge and skills, identification of areas for growth or areas where practice has evolved, and a proactive search for relevant, high-quality continuing education opportunities. This process should be guided by the counselor's scope of practice, the needs of their client population, and the evolving landscape of addiction treatment research and best practices. Regular review of professional literature and engagement with peers can also inform this process. Question 4. Upon reviewing the intake information for a new client, a counselor notes that the client, who identifies as belonging to a specific indigenous community, describes their substance use as a way to cope with historical trauma and a sense of displacement from their ancestral lands. The client also expresses a strong reliance on community elders and traditional healing practices for support, which they believe are more effective than formal treatment. How should the counselor proceed with the assessment process? Option A. Directly challenge the client's belief that traditional healing practices are more effective than formal treatment, explaining the scientific basis of evidence-based interventions and encouraging them to focus on the immediate cessation of substance use as the primary goal. Option B. Integrate the client's cultural explanations and community support systems into the assessment, using open-ended questions to explore the meaning of historical trauma and displacement in relation to substance use, and inquire about how traditional healing practices might complement or inform a treatment plan. Option C. Acknowledge the client's cultural background, but proceed with a primary focus on the diagnostic criteria for substance use disorders as outlined in the DSM, interpreting the client's explanations of trauma and community support as potential barriers to engagement with conventional treatment. Option D. Administer standard diagnostic questionnaires for substance use disorders and mental health conditions, focusing on objective symptom presentation and comparing the client's responses to normative data, while gently encouraging the client to prioritize evidence-based Western treatment modalities. The correct answer is B. Integrate the client's cultural explanations and community support systems into the assessment, using open-ended questions to explore the meaning of historical trauma and displacement in relation to substance use, and inquire about how traditional healing practices might complement or inform a treatment plan. Explanation. This scenario presents a common ethical challenge in substance use disorder counseling where cultural nuances can significantly impact assessment accuracy and client engagement. The professional's responsibility is to conduct a comprehensive assessment that respects the client's background and avoids imposing a dominant cultural perspective. The correct approach prioritizes understanding the client's worldview and how it intersects with their substance use and help-seeking behaviors. This aligns with IC and RC ADC domains that emphasize the counselor's role in facilitating client growth and development, which inherently requires cultural competence. Best professional practice dictates that assessment tools and interpretations should be culturally sensitive, acknowledging that concepts like family obligation, spiritual beliefs, and community roles can influence an individual's experience and expression of addiction. The counselor must actively seek to understand these factors from the client's perspective, rather than assuming universal applicability of Western diagnostic criteria or treatment approaches. This fosters trust, improves diagnostic accuracy, and lays the groundwork for a collaborative treatment plan. An incorrect approach that relies solely on standardized, culturally generic assessment tools without considering the client's background risks misinterpretation and pathologizing behaviors that are culturally normative. This fails to meet the ethical obligation to provide services that are responsive to the client's unique needs and cultural context. Another incorrect approach that dismisses the client's cultural explanations for their substance use as mere excuses or denial overlooks the profound influence of culture on behavior and decision-making. This can lead to a strained therapeutic relationship and a treatment plan that is irrelevant or even detrimental to the client's well-being. Finally, an approach that imposes the counselor's own cultural values or assumptions onto the client's situation is a direct violation of ethical principles that mandate respect for client autonomy and self-determination. Professionals should employ a decision-making framework that begins with self-awareness of their own cultural biases. They should then actively seek to understand the client's cultural framework through open-ended questions, active listening, and a willingness to learn. When using assessment tools, professionals should consider their cultural validity and adapt their interpretation based on the client's cultural context. Collaboration with the client in defining the problem and developing solutions is paramount, ensuring that the treatment plan is culturally congruent and meaningful. Question 5. During the evaluation of a client presenting with a history of polysubstance use and recent legal difficulties, the client expresses a strong desire to avoid inpatient treatment, stating they believe they can manage their substance use with outpatient services and support group attendance. The counselor has conducted a preliminary risk assessment indicating a moderate risk of relapse and potential for continued legal complications if substance use is not effectively managed. What is the most appropriate next step in developing the treatment plan? Option A. Collaborate with the client to develop a comprehensive outpatient treatment plan that incorporates evidence-based interventions targeting their specific substance use patterns and risk factors, while clearly outlining the rationale for this level of care and establishing clear criteria for escalation to higher levels of care if needed. Option B. Agree to the client's request for only outpatient services and support groups, assuming their self-assessment of readiness is accurate and sufficient. Option C. Immediately recommend inpatient detoxification and rehabilitation services, overriding the client's preference due to the identified moderate risk of relapse and legal issues. Option D. Focus the treatment plan solely on addressing the legal issues, with minimal emphasis on substance use treatment, as this is the most immediate consequence the client is concerned about. The correct answer is A. Collaborate with the client to develop a comprehensive outpatient treatment plan that incorporates evidence-based interventions targeting their specific substance use patterns and risk factors, while clearly outlining the rationale for this level of care and establishing clear criteria for escalation to higher levels of care if needed. Explanation. This scenario presents a common challenge in substance use disorder treatment, balancing the immediate need for intervention with the client's expressed readiness and the counselor's ethical obligation to respect client autonomy. A critical aspect of treatment planning, particularly when utilizing a risk assessment framework, is ensuring that the plan is not only evidence-based but also tailored to the individual's specific needs, strengths, and stage of change. The IC and RC ADC exam emphasizes the importance of a comprehensive assessment that informs a client-centered treatment plan. The correct approach prioritizes a thorough risk assessment that considers multiple domains, including the client's history of substance use, potential for harm to self or others, and their current level of functioning. This approach aligns with regulatory frameworks that mandate individualized treatment plans based on objective assessment data. It ensures that the plan addresses the identified risks and needs effectively, while also incorporating the client's input and readiness for change, which is crucial for engagement and treatment success. This respects the client's autonomy while fulfilling the counselor's duty of care. An incorrect approach would be to solely rely on the client's stated desire to avoid more intensive services without a comprehensive risk assessment. This fails to adequately address potential risks that the client may not fully perceive or acknowledge, potentially leading to inadequate care and increased risk of relapse or harm. Ethically, this could be seen as a failure to provide appropriate care and a potential breach of the duty to protect. Another incorrect approach would be to impose a high-intensity treatment plan without considering the client's readiness or engagement, which can lead to resistance, dropout, and a breakdown in the therapeutic alliance. This disregards the principle of client-centered care and can be counterproductive. Professionals should employ a decision-making process that begins with a comprehensive assessment, including a validated risk assessment tool. This data should then be integrated with the client's self-report, stage of change, and expressed preferences. The treatment plan should be developed collaboratively, with clear justification for the level and type of services recommended, based on the identified risks and needs. Regular reassessment and flexibility in the plan are also crucial to adapt to the client's progress and changing circumstances. Question 6. The performance metrics show a significant increase in client self-disclosure regarding potential risks to others during group counseling sessions. During one session, a participant discloses information that suggests a credible and imminent threat of harm to an identifiable third party outside of the group. What is the most ethically sound and legally compliant course of action for the counselor? Option A. Advise the group member to handle the situation themselves and refrain from any external intervention. Option B. Immediately disclose the information to the entire group and inform the third party mentioned about the threat. Option C. Consult with a supervisor or experienced colleague to assess the threat and determine the appropriate reporting obligations, potentially including breaking confidentiality to report the threat to relevant authorities or the intended victim. Option D. Maintain absolute confidentiality of the information shared by the group member, as all disclosures within the group are considered confidential. Correct answer is C. Consult with a supervisor or experienced colleague to assess the threat and determine the appropriate reporting obligations, potentially including breaking confidentiality to report the threat to relevant authorities or the intended victim. Explanation. Scenario analysis. This scenario presents a common ethical challenge in group counseling, where a counselor must balance client confidentiality with the need to address potential harm to others. The counselor has received information from a group member that suggests a potential risk to an outside individual. The professional challenge lies in determining the appropriate course of action without violating the trust established within the group or breaching confidentiality inappropriately, while also upholding the duty to protect. Correct approach analysis. The correct approach involves a careful, stepwise process that prioritizes safety while adhering to ethical and legal obligations. This includes assessing the credibility and imminence of the threat, consulting with supervisors or colleagues, and understanding the specific legal and ethical mandates regarding reporting. The IC and RC ADC exam emphasizes the counselor's responsibility to protect clients and the public. When a credible threat of serious harm to an identifiable third party is communicated, the counselor has a legal and ethical obligation to take reasonable steps to prevent that harm. This often involves breaking confidentiality to report the threat to appropriate authorities or the intended victim, but only after careful assessment and consultation. Incorrect approaches analysis. One incorrect approach involves maintaining absolute confidentiality regardless of the information shared. This fails to uphold the counselor's duty to protect, which is a critical ethical and legal standard in many jurisdictions, including those relevant to the IC and RC ADC exam. Ignoring a credible threat of harm to an identifiable third party can have severe consequences and constitutes a breach of professional responsibility. Another incorrect approach is to immediately disclose the information to the entire group or to the individual mentioned without proper assessment or consultation. This violates client confidentiality within the group setting and can damage the therapeutic alliance and the safety of the group environment. It also bypasses the necessary steps of risk assessment and professional consultation, which are crucial for making sound ethical decisions. A third incorrect approach is to do nothing, assuming the information is not serious or that the group member will not act on it. This is a failure to assess risk and a dereliction of the counselor's duty to protect. Ethical codes and legal frameworks require proactive intervention when there is a reasonable suspicion of harm. Professional reasoning. Professionals should approach such situations by first remaining calm and gathering more information from the group member if possible, without further alarming them. The next critical step is to consult with a supervisor or experienced colleague to discuss the situation and explore options. This consultation should be documented. The counselor must then assess the credibility, imminence, and specificity of the threat. Based on this assessment and consultation, the counselor must determine the appropriate action, which may include reporting to law enforcement or the intended victim, in accordance with applicable laws and ethical guidelines. The decision-making process should be guided by a commitment to client welfare, public safety, and adherence to professional standards. Question 7. Consider a scenario where a counselor is conducting an initial assessment with a client presenting with polysubstance use. The client expresses a desire to reduce their use, but states they are not ready for residential treatment, believing they can manage their issues with outpatient support and individual therapy. The counselor observes signs of significant withdrawal symptoms and notes a history of relapse after previous outpatient attempts. The counselor must determine the most appropriate next step in the assessment and initial treatment planning process. Option A. Accept the client's stated preference for outpatient support and individual therapy without further exploration, focusing solely on developing a plan for those services. Option B. Engage the client in a discussion about the observed withdrawal symptoms and relapse history, exploring their understanding of the risks and benefits of different levels of care, and collaboratively determining a treatment plan that addresses their immediate needs and stated preferences while mitigating identified risks. Option C. Immediately refer the client to a residential treatment program, explaining that their current presentation and history necessitate a higher level of care for safety and effective recovery. Option D. Focus the assessment exclusively on the client's expressed desire to reduce use and their readiness for outpatient services, deferring any discussion of higher levels of care until the client explicitly requests it. The correct answer is B. Engage the client in a discussion about the observed withdrawal symptoms and relapse history, exploring their understanding of the risks and benefits of different levels of care, and collaboratively determining a treatment plan that addresses their immediate needs and stated preferences while mitigating identified risks. Explanation. This scenario presents a common implementation challenge in substance use disorder counseling, balancing the immediate need for intervention with the client's expressed readiness and the counselor's ethical obligation to respect client autonomy. The professional challenge lies in accurately assessing the client's strengths and needs, particularly when there's a discrepancy between the counselor's perception of risk and the client's self-assessment. Critical aspect of this is adhering to the IC and RC ADC exam's emphasis on client-centered care and evidence-based practices, which require a thorough, individualized assessment rather than a one-size-fits-all approach. The correct approach represents best professional practice because it prioritizes a comprehensive, multifaceted assessment that integrates the counselor's observations with the client's self-report and collateral information. This aligns with IC and RC core competencies, which stress the importance of gathering sufficient data to inform treatment planning and intervention. Specifically, it upholds the ethical principle of respecting client autonomy by not imposing a treatment plan that the client does not understand or agree with, while still addressing potential risks. It also reflects best practice in needs assessment by considering a broad range of factors beyond just the immediate crisis. An incorrect approach that immediately mandates a higher level of care without further exploration fails to conduct a thorough needs assessment. This could lead to unnecessary escalation, potentially alienating the client and undermining the therapeutic alliance, which is crucial for successful treatment. Ethically, it bypasses the client's right to participate in treatment planning and may violate principles of least restrictive intervention. Another incorrect approach that relies solely on the client's self-report, ignoring observable indicators of risk, neglects the counselor's professional responsibility to assess for safety and potential harm, which is a core ethical and regulatory requirement. This could result in inadequate treatment planning and increased risk to the client. The professional decision-making process for similar situations should involve a systematic approach. First, acknowledge and validate the client's perspective. Second, conduct a thorough assessment, utilizing multiple sources of information. Client interview, observation, potentially collateral contacts if appropriate and consented to. Third, collaboratively interpret the assessment findings with the client, explaining the rationale for any recommended interventions. Fourth, develop a treatment plan that is responsive to the client's needs and strengths, while also addressing identified risks, and ensure the client understands and agrees to the plan. This iterative process ensures that interventions are both effective and ethically sound. Question 8. The review process indicates that during a counseling session, a client expresses intense anger towards their former supervisor, stating, "I'm going to make them pay for what they did to me. I know where they live, and I'm going to go over there tonight and teach them a lesson they won't forget." As an alcohol and drug counselor operating under the IC and RC ADC exam framework, what is the most appropriate immediate course of action? Option A. Reassure the client that their feelings are valid but avoid directly addressing the threat, hoping the anger will dissipate without further action. Option B. Document the client's statement thoroughly, consult with a supervisor or legal counsel regarding the duty to warn, and then take appropriate steps to protect the potential victim and comply with reporting obligations. Option C. Immediately contact the former supervisor to warn them of the potential danger without consulting with a supervisor or legal counsel. Option D. Advise the client that such threats are unacceptable and terminate the counseling relationship without further assessment or reporting. The correct answer is B. Document the client's statement thoroughly, consult with a supervisor or legal counsel regarding the duty to warn, and then take appropriate steps to protect the potential victim and comply with reporting obligations. Explanation. This scenario presents a common ethical dilemma for alcohol and drug counselors, balancing client confidentiality with the duty to protect potential victims. The challenge lies in interpreting the nuances of the duty to warn, which is a legal and ethical obligation that can override confidentiality when a client poses a clear and imminent danger to an identifiable third party. Counselors must carefully assess the credibility and imminence of the threat, adhering to both legal mandates and professional ethical codes. The correct approach prioritizes the safety of the potential victim, while still attempting to manage the situation within the therapeutic relationship as much as possible, and adhering to reporting requirements. This involves a thorough assessment of the client's statements, consultation with supervisors or legal counsel, and then taking appropriate action to warn the potential victim and/or relevant authorities, as dictated by state law and professional ethical standards. This approach upholds the counselor's ethical responsibility to protect others from harm, a principle that generally supersedes strict confidentiality when specific criteria are met. An incorrect approach would be to dismiss the client's statements without a thorough assessment, thereby failing to uphold the duty to warn if a genuine threat exists. Another incorrect approach is to immediately breach confidentiality without proper assessment or consultation, potentially damaging the therapeutic alliance unnecessarily and violating client rights if the threat is not imminent or credible. Failing to consult with supervisors or legal counsel when facing such a complex ethical and legal obligation is also a significant professional failure, as it demonstrates a lack of due diligence in navigating the intricacies of reporting requirements and potential legal ramifications. Professionals should employ a decision-making framework that begins with a thorough assessment of the client's statements, considering the specificity, imminence, and credibility of any expressed threats. This should be followed by consultation with supervisors, experienced colleagues, or legal counsel to ensure compliance with relevant laws and ethical codes. Documentation of all assessments, consultations, and actions taken is crucial. The ultimate decision must be guided by the principle of protecting potential victims, while minimizing the breach of confidentiality to the extent necessary and legally permissible. Question 9. Which approach would be most ethically and legally sound for an alcohol and drug counselor who, during a session, receives information from a client that raises a reasonable suspicion of child abuse involving the client's minor child? Option A. Advise the client that they must report the suspected abuse and then wait for the client to make the report themselves. Option B. Attempt to gather more definitive evidence of the abuse from the client before making any report to external agencies. Option C. Document the suspicion in the client's file and discuss it with a colleague during a peer supervision session before deciding whether to report. Option D. Immediately report the suspicion to the appropriate Child Protective Services agency as required by law. The correct answer is D. Immediately report the suspicion to the appropriate Child Protective Services agency as required by law. Explanation. This scenario presents a professional challenge due to the inherent conflict between a counselor's duty to maintain client confidentiality and the legal mandate to report suspected child abuse. The counselor must navigate these competing obligations with careful judgment, prioritizing the safety of a potential victim while upholding ethical standards and legal requirements. The core of the dilemma lies in balancing the client's trust and the potential harm to a child. The correct approach represents best professional practice because it aligns with the legal reporting requirements for suspected child abuse, which supersede general confidentiality in such critical situations. Alcohol and drug counselors are mandated reporters in most jurisdictions, meaning they have a legal and ethical obligation to report reasonable suspicion of child abuse or neglect to the appropriate authorities. This action is grounded in the principle of duty to protect and is often codified in state statutes and professional codes of ethics, such as those promoted by IC and RC. Prompt reporting allows for an investigation and intervention to ensure the child's safety, which is paramount. An incorrect approach that involves delaying the report to gather more definitive proof or to discuss the situation with the client first is professionally unacceptable. This delay could put the child at further risk and potentially violate reporting timelines mandated by law. Failing to report based on reasonable suspicion, even if the information is not definitively confirmed, constitutes a breach of the counselor's legal duty as a mandated reporter and an ethical failure to protect a vulnerable individual. Another incorrect approach, such as reporting the suspicion to a supervisor without making the official report to Child Protective Services, is also insufficient. While supervision is important for professional development and ethical guidance, it does not absolve the counselor of their direct legal responsibility to report. The ultimate responsibility for making the mandated report rests with the individual counselor. The professional decision-making process in such situations should involve immediate recognition of the potential reporting obligation. Counselors should be familiar with their jurisdiction's child abuse reporting laws and their professional code of ethics regarding mandated reporting. Upon forming a reasonable suspicion, the immediate step should be to make the report to the designated child protective agency. If there is uncertainty about the threshold for reporting, consulting with a supervisor or legal counsel experienced in mandated reporting laws is advisable, but this consultation should not delay the initial report if reasonable suspicion exists. The focus must always be on the safety and well-being of the child. Question 10. Quality control measures reveal that during a crisis intervention session, a client becomes increasingly agitated, expressing suicidal ideation and making vague threats towards their family. The counselor is alone with the client in the office. Which of the following crisis intervention strategies best aligns with professional ethical guidelines and best practices for immediate safety and client care? Option A. Attempt to de-escalate the situation through active listening and empathy, while assessing the immediacy and lethality of the suicidal ideation and threats, and considering the least restrictive intervention necessary to ensure safety. Option B. Inform the client that their behavior is disruptive and that the session will be terminated if they do not calm down immediately. Option C. Focus the conversation on the client's past history of similar crises to understand the root cause of their current distress. Option D. Immediately contact law enforcement to have the client removed from the premises due to the expressed threats and suicidal ideation. The correct answer is A. Attempt to de-escalate the situation through active listening and empathy, while assessing the immediacy and lethality of the suicidal ideation and threats, and considering the least restrictive intervention necessary to ensure safety. Explanation. This scenario presents a common challenge in crisis intervention, balancing immediate safety and de-escalation with the client's autonomy and the counselor's ethical obligations. The counselor must act swiftly to ensure the safety of all involved, including themselves, while also respecting the client's dignity and right to self-determination, as outlined by IC and RC ADC exam standards. The professional challenge lies in assessing the immediate risk and determining the most appropriate intervention without resorting to overly restrictive measures or abandoning the client. The correct approach prioritizes immediate safety through de-escalation techniques and a non-judgmental stance, while simultaneously assessing the client's immediate needs and potential for harm. This aligns with best professional practice by adhering to the principle of do no harm and the ethical imperative to provide services in a manner that respects client rights and promotes well-being. It involves active listening, empathy, and a focus on the client's current distress, which are foundational to effective crisis intervention and consistent with IC and RC ethical guidelines regarding client welfare and professional conduct. An incorrect approach that involves immediately calling law enforcement without attempting de-escalation or assessing the immediate threat to self or others fails to uphold the principle of least restrictive intervention. This could be seen as an overreaction and a violation of client trust, potentially damaging the therapeutic relationship and contravening ethical guidelines that emphasize client dignity and the counselor's role in facilitating a safe and supportive environment. Another incorrect approach, such as dismissing the client's distress as a mere attention-seeking behavior, demonstrates a lack of empathy and a failure to recognize the severity of a crisis, which is a direct ethical lapse in client care and a disregard for the potential for escalation. Finally, an approach that focuses solely on the client's past behaviors rather than their current crisis state neglects the immediate need for stabilization and support and can be perceived as judgmental, undermining the core principles of crisis intervention and ethical counseling practice. Professionals should employ a decision-making framework that begins with a rapid risk assessment, followed by attempts at de-escalation and establishing rapport. If immediate safety is compromised, the next step involves considering the least restrictive intervention necessary to ensure safety, which may include involving other support systems or, as a last resort, emergency services. Throughout the process, maintaining a non-judgmental attitude and respecting the client's autonomy as much as possible are paramount. Question 11. Cost-benefit analysis shows that implementing evidence-based practices, EB, in substance use treatment can lead to improved client outcomes and more efficient use of resources. When considering the most effective approach to integrating EBPs into a treatment program, which of the following strategies best aligns with professional standards and ethical guidelines for alcohol and drug counselors? Option A. Focus exclusively on EBPs that are easiest to implement with existing staff and resources, even if they have less robust research backing for the specific client population. Option B. Implement EBPs strictly as outlined in their original research protocols, without any modification, to ensure fidelity and maximize the likelihood of achieving the documented outcomes. Option C. Rely primarily on traditional, non-evidence-based counseling approaches that have been used historically, as they are familiar and require less training for staff. Option D. Prioritize the selection and consistent application of EBPs that have demonstrated strong research support for the client's specific substance use disorder, while remaining flexible to adapt interventions based on client engagement, cultural relevance, and individual progress. The correct answer is D. Prioritize the selection and consistent application of EBPs that have demonstrated strong research support for the client's specific substance use disorder, while remaining flexible to adapt interventions based on client engagement, cultural relevance, and individual progress. Explanation. Scenario analysis. This scenario presents a common challenge in substance use treatment where a counselor must balance the efficacy of evidence-based practices, EP, with the practical realities of client engagement and resource availability. The professional challenge lies in selecting and implementing treatment modalities that are not only supported by research, but also adaptable to the unique needs and circumstances of individual clients, while adhering to ethical guidelines and regulatory frameworks. Careful judgment is required to avoid imposing a one-size-fits-all approach and to ensure that treatment is client-centered and culturally competent. Correct approach analysis. The correct approach emphasizes the integration of EBPs with a client-centered philosophy, acknowledging that while EBPs provide a strong foundation, their application must be flexible. This aligns with the IC and RC ADC exams' focus on competent and ethical practice, which requires counselors to stay abreast of current research and to tailor interventions to individual client needs, strengths, and preferences. Ethical practice dictates that treatment should be effective and respectful of client autonomy, which is best achieved by adapting EBPs rather than rigidly adhering to them without consideration for the client's context. Regulatory frameworks often support the use of evidence-based approaches, while also emphasizing client rights and individualized care plans. Incorrect approach is analysis. One incorrect approach fails to acknowledge the importance of client engagement and cultural relevance, potentially leading to treatment non-adherence and poor outcomes. This violates the ethical principle of beneficence and non-maleficence, as it may result in ineffective or even harmful treatment if the client does not connect with or benefit from the chosen modality. It also disregards the regulatory expectation for client-centered care. Another incorrect approach prioritizes readily available, less evidence-based methods over more effective, albeit potentially more resource-intensive, EP. This is ethically problematic as it may not provide the client with the best possible care, potentially violating the duty to provide competent services. It also fails to meet the spirit of regulatory requirements that encourage the use of effective, research-supported interventions. A third incorrect approach focuses solely on the theoretical efficacy of EBPs without considering the practical implementation challenges or the client's readiness for change. This can lead to frustration for both the counselor and the client, as well as a failure to achieve treatment goals. Ethically, counselors are expected to be realistic in their treatment planning and to manage client expectations, which includes understanding the practicalities of implementing EBPs. Professional reasoning. Professionals should approach treatment planning by first identifying EBPs relevant to the client's specific substance use disorder and co-occurring conditions. This should be followed by a thorough assessment of the client's strengths, weaknesses, preferences, cultural background, and readiness for change. The chosen intervention should then be a collaborative decision between the counselor and the client, with a clear understanding of how the EBP will be adapted to meet the client's unique needs. Ongoing monitoring of progress and client feedback are crucial for adjusting the treatment plan as necessary, ensuring that the treatment remains both evidence-based and client-centered. Question 12. The investigation demonstrates that a counselor, while conducting a session with an adult client, receives information that the client's minor child has recently sustained unexplained bruises. The client expresses significant distress and states they are worried about their child's well-being, but also emphasizes their desire for privacy and fear of legal repercussions if they report this to authorities. The counselor is aware of the jurisdiction's mandated reporting laws concerning child abuse. What is the most appropriate course of action for the counselor in this situation? Option A. Consult with a supervisor or colleague about the situation, anonymizing client details before taking any action. Option B. Maintain strict confidentiality regarding the client's disclosure, focusing solely on the client's immediate emotional distress and therapeutic needs. Option C. Immediately report the information to the appropriate Child Protective Services agency, as mandated by law, while also informing the client about the limits of confidentiality and the reporting process. Option D. Advise the client to seek legal counsel to understand their reporting obligations and potential consequences without making a report themselves. The correct answer is C. Immediately report the information to the appropriate Child Protective Services agency, as mandated by law, while also informing the client about the limits of confidentiality and the reporting process. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent tension between a client's expressed desire for confidentiality and the counselor's legal and ethical obligations to report certain information. The counselor must navigate the complex legal landscape of mandated reporting while upholding the therapeutic alliance and respecting client autonomy. The specific jurisdiction's laws regarding child abuse, elder abuse, and imminent harm are paramount in guiding the counselor's decision-making process. Correct approach analysis. The correct approach involves a careful assessment of the client's statements against the specific reporting thresholds defined by the relevant jurisdiction's laws and ethical codes. If the client's disclosure clearly meets the criteria for a reportable offense, e.g., credible suspicion of child abuse, the counselor must follow the mandated reporting procedures. This upholds the legal duty to protect vulnerable individuals and aligns with the ethical principle of beneficence, acting in the best interest of others. The counselor should also inform the client about the limits of confidentiality as per the jurisdiction's regulations and their professional code of ethics, ideally at the outset of therapy. Incorrect approaches analysis. Failing to report a clearly mandated situation constitutes a violation of the law and ethical codes, potentially leading to legal repercussions and professional sanctions. This approach prioritizes client confidentiality over the safety of a potential victim, which is ethically indefensible when legal mandates exist. Reporting without a clear legal basis or sufficient credible information can breach client confidentiality unnecessarily, damaging the therapeutic relationship and potentially violating privacy laws. This approach may stem from an overzealous interpretation of reporting duties or a lack of understanding of the specific legal thresholds. Seeking advice from colleagues without proper anonymization of client information or without following established consultation protocols can also lead to breaches of confidentiality. While consultation is encouraged, it must be done in a manner that protects client identity and adheres to ethical guidelines. Professional reasoning. Professionals must develop a systematic decision-making process that begins with understanding the specific legal and ethical mandates of their jurisdiction. This includes knowing the definitions and reporting requirements for child abuse, elder abuse, and imminent danger. When faced with a potentially reportable situation, the counselor should 1. Assess the credibility and specificity of the client's disclosure against legal definitions. 2. Consult relevant legal statutes and professional ethical codes. 3. If reporting is mandated, follow the established procedures for reporting, including timely notification to the appropriate authorities. 4. Inform the client about the limits of confidentiality and the reporting action taken, if appropriate and safe to do so. 5. Document all actions and decisions thoroughly. Question 13. The assessment process reveals a client who expresses significant doubt about their ability to achieve sobriety and has a history of relapsing after previous treatment attempts. The counselor is considering how to best initiate the therapeutic relationship. Which of the following approaches is most likely to foster a strong therapeutic alliance and encourage client engagement? Option A. Empathetically acknowledge the client's ambivalence and past struggles, and collaboratively explore their personal reasons for considering change, validating their feelings while gently probing for their own insights into potential solutions. Option B. Focus the initial session on outlining all the potential risks and negative outcomes associated with continued substance use, aiming to shock the client into recognizing the urgency of their situation. Option C. Immediately present a detailed treatment plan with strict adherence requirements, emphasizing the severe consequences of noncompliance to ensure the client understands the seriousness of their situation. Option D. Share personal stories of overcoming addiction and achieving long-term recovery, highlighting the counselor's own journey as a source of inspiration and a roadmap for the client. The correct answer is A. Empathetically acknowledge the client's ambivalence and past struggles, and collaboratively explore their personal reasons for considering change, validating their feelings while gently probing for their own insights into potential solutions. Explanation. The assessment process reveals a client presenting with significant ambivalence regarding treatment, coupled with a history of failed attempts at sobriety. This scenario is professionally challenging because building trust and a strong therapeutic alliance is paramount for engagement and successful outcomes, especially with clients who have experienced setbacks. The counselor must navigate the client's skepticism and potential resistance while establishing a safe and supportive environment. Careful judgment is required to select an approach that fosters collaboration rather than imposing an agenda, which could further alienate the client. The correct approach represents best professional practice by prioritizing empathy, active listening, and validation of the client's feelings and experiences. This aligns with the core principles of motivational interviewing and person-centered therapy, which are foundational in substance use counseling. By reflecting the client's ambivalence and exploring their own motivations for change, the counselor demonstrates respect for their autonomy and builds a collaborative partnership. This approach is ethically sound as it upholds client dignity and self-determination, and it is consistent with IC and RC ADC standards that emphasize client-centered care and the importance of a strong therapeutic relationship for treatment efficacy. An incorrect approach that focuses solely on presenting the risks of continued substance use without acknowledging the client's perspective fails to build rapport. This can be perceived as judgmental and confrontational, potentially triggering defensiveness and disengagement. Ethically, This approach neglects the principle of beneficence by not adequately considering the client's readiness for change and their emotional state, and it may violate the counselor's duty to establish a trusting relationship. Another incorrect approach that involves immediately setting rigid treatment goals and expectations without client input disregards the client's agency. This can undermine the therapeutic alliance by making the client feel unheard and controlled. It is ethically problematic as it infringes upon the client's right to participate in treatment planning and can be seen as a failure to adhere to best practices in client engagement, which are implicitly supported by IC and RC standards for effective counseling. A third incorrect approach that involves sharing personal anecdotes of recovery without a clear therapeutic purpose can be perceived as self-serving or an attempt to bypass the client's unique struggles. While personal stories can sometimes be helpful, their use must be carefully considered and client-focused. Without this careful consideration, it can shift the focus away from the client and potentially create an imbalance in the therapeutic relationship, hindering the development of a strong alliance. This approach lacks the professional judgment required to maintain appropriate boundaries and client-centeredness. The professional reasoning process for similar situations should involve a continuous assessment of the client's readiness for change, their emotional state, and the dynamics of the therapeutic relationship. Counselors should employ active listening, empathetic reflection, and open-ended questions to understand the client's perspective. They should then collaboratively explore options and goals, tailoring interventions to the client's individual needs and strengths, always prioritizing the establishment and maintenance of a strong, trusting therapeutic alliance. Question 14. Performance analysis shows a client in an outpatient substance use disorder program has expressed a desire for minimal intervention, preferring to focus on practical support and social connection rather than direct exploration of their substance use behaviors. The counselor believes that introducing more structured behavioral interventions, such as motivational interviewing or cognitive behavioral therapy, would be more beneficial for the client's long-term recovery at this stage. What is the most appropriate course of action for the counselor? Option A. Refer the client to a different counselor who is more aligned with providing minimal intervention, as this client's needs do not match the counselor's preferred therapeutic style. Option B. Adhere strictly to the client's stated preference for minimal intervention, providing only practical support and social connection without introducing any behavioral techniques. Option C. Initiate a discussion with the client about their readiness for more structured behavioral interventions, explaining the potential benefits while respecting their current preferences and collaboratively planning the next steps. Option D. Immediately implement cognitive behavioral therapy techniques to address the client's substance use behaviors, as this is a recognized evidence-based intervention. The correct answer is C. Initiate a discussion with the client about their readiness for more structured behavioral interventions, explaining the potential benefits while respecting their current preferences and collaboratively planning the next steps. Explanation. This scenario presents a common challenge in substance use disorder counseling, balancing the client's stated goals with the counselor's professional judgment regarding the most effective therapeutic intervention. The counselor must consider the client's readiness for change, their current level of insight, and the potential for a chosen intervention to be counterproductive if not appropriately timed or implemented. The IC and RC ADC exam emphasizes evidence-based practices and ethical considerations, requiring counselors to select interventions that are not only client-centered, but also grounded in established therapeutic principles and regulatory guidelines for client care. The correct approach involves a collaborative discussion with the client about their readiness for more intensive behavioral interventions, such as motivational interviewing or cognitive behavioral therapy, while acknowledging their current preference for less structured support. This approach respects client autonomy and the stages of change model, allowing the counselor to build rapport and assess the client's capacity for engagement before introducing more demanding techniques. It aligns with ethical principles of informed consent and client-centered care, ensuring that interventions are tailored to the individual's needs and readiness, as expected by IC and RC standards for competent practice. An incorrect approach would be to immediately implement a highly structured behavioral intervention without assessing the client's readiness. This could lead to client resistance, disengagement, and a breakdown in the therapeutic alliance, potentially violating the ethical obligation to provide care that is appropriate and beneficial to the client. Another incorrect approach would be to solely rely on the client's stated preference for minimal intervention, even if the counselor believes more intensive support is clinically indicated. This could be seen as a failure to advocate for the client's best interests and a missed opportunity to facilitate deeper therapeutic progress, potentially contravening professional standards that require counselors to utilize their expertise to guide treatment. Professionals should employ a decision-making process that begins with a thorough assessment of the client's current status, including their stage of change, motivation, and insight. This assessment should inform the selection of appropriate behavioral interventions. A collaborative approach, where the counselor discusses potential interventions with the client, explaining the rationale and benefits, is crucial. This process ensures that the client feels heard and respected, fostering engagement and adherence to treatment. Counselors must continually reevaluate the effectiveness of interventions and be prepared to adjust their approach based on the client's progress and feedback, always adhering to ethical codes and regulatory requirements. Question 15. Process analysis reveals that a client presents with a history of alcohol dependence and a recently diagnosed generalized anxiety disorder. The client expresses a desire to stop drinking, but also significant apprehension about social situations, which they report exacerbates their anxiety and has previously led to increased alcohol consumption. Which initial approach best addresses the client's complex presentation and facilitates a safe and effective risk assessment? Option A. Suggest a group therapy specifically for anxiety management, assuming it will indirectly help with substance use by reducing overall distress. Option B. Initiate individual therapy to conduct a comprehensive risk assessment and develop personalized coping strategies before considering group interventions. Option C. Advise the client to focus on self-help resources for anxiety management before commencing any formal treatment for substance use. Option D. Recommend immediate enrollment in a general substance use disorder group therapy session to provide peer support and accountability. Correct answer is B. Initiate individual therapy to conduct a comprehensive risk assessment and develop personalized coping strategies before considering group interventions. Explanation. Scenario analysis. This scenario presents a common challenge for alcohol and drug counselors, determining the most effective therapeutic modality for a client presenting with co-occurring anxiety and substance use disorder. The challenge lies in balancing the client's immediate need for support and skill building with the potential benefits and limitations of different therapeutic approaches, all while adhering to professional standards and ethical guidelines. A critical judgment is required to select an approach that maximizes the client's engagement and treatment outcomes while minimizing potential risks. Correct approach analysis. Prioritizing individual therapy for initial risk assessment and stabilization is best professional practice in this situation. This approach allows the counselor to conduct a thorough, in-depth assessment of the client's specific anxiety triggers, substance use patterns, and the interplay between the two. It provides a safe and confidential space for the client to explore sensitive issues, build rapport with the counselor, and develop coping mechanisms tailored to their unique needs. This aligns with the IC and RC ADC exam's emphasis on client-centered care and the ethical imperative to provide services that are appropriate to the client's condition and the counselor's scope of practice. A detailed individual assessment is foundational for determining if group therapy would be beneficial or potentially detrimental at this stage. Incorrect approaches analysis. Recommending immediate enrollment in a general substance use disorder group therapy without a prior individual risk assessment is professionally unacceptable. This approach fails to account for the client's co-occurring anxiety, which may make them hesitant to disclose in a group setting or exacerbate their symptoms due to the social pressure. It bypasses the crucial step of understanding the individual's specific needs and readiness for group participation, potentially leading to premature dropout or negative therapeutic experiences. This violates the ethical principle of beneficence by not ensuring the treatment is tailored to the client's best interest. Suggesting that the client solely manage their anxiety through self-help resources before addressing the substance use disorder is also professionally unsound. While self-help can be a supplementary tool, it is insufficient as a primary intervention for co-occurring disorders. It neglects the counselor's responsibility to provide direct therapeutic intervention and support for both conditions. This approach could be seen as a failure to provide adequate care and could lead to the client's condition worsening due to lack of professional guidance. Focusing exclusively on group therapy for anxiety management without considering the substance use disorder is equally problematic. While group therapy can be effective for anxiety, it may not adequately address the complex interplay with substance use. The client's substance use may be a coping mechanism for their anxiety, and treating anxiety in isolation without addressing the substance use could lead to relapse or the development of new maladaptive coping strategies. This demonstrates a lack of integrated treatment planning, which is essential for co-occurring disorders. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a comprehensive individual assessment. This assessment should explore the nature and severity of both the substance use disorder and the co-occurring anxiety, including triggers, coping mechanisms, and the client's readiness for different treatment modalities. Based on this assessment, the counselor can then determine the most appropriate initial intervention, which may include individual therapy to build rapport and address immediate concerns, followed by a carefully considered integration of group therapy when the client is deemed ready and when it aligns with their specific treatment goals. This phased approach ensures that interventions are evidence-based, client-centered, and ethically sound. Question 16. The assessment process reveals a client's history of trauma and their expressed reluctance to discuss certain personal details. The counselor needs to obtain informed consent for the assessment. Which of the following actions best upholds the principles of informed consent and client autonomy within the scope of the IC and RC ADC exam's ethical guidelines? Option A. Clearly explain the purpose of the assessment, the types of information to be gathered, how it will be used and protected, and the client's right to refuse to answer any question or withdraw consent at any time without penalty, while also acknowledging their expressed reluctance and offering to discuss their concerns. Option B. Emphasize to the client that full disclosure of all personal details is mandatory for effective treatment and that withholding information will hinder their progress. Option C. Begin the assessment immediately to gather essential information and provide a detailed explanation of informed consent and confidentiality only after the initial data collection is complete. Option D. Proceed with the assessment as planned, assuming that by agreeing to the assessment, the client has implicitly consented to all aspects of the process and address any discomfort later if it arises. The correct answer is A. Clearly explain the purpose of the assessment, the types of information to be gathered, how it will be used and protected, and the client's right to refuse to answer any question or withdraw consent at any time without penalty, while also acknowledging their expressed reluctance and offering to discuss their concerns. Explanation. The assessment process reveals a client's history of trauma and their expressed reluctance to discuss certain personal details. This scenario is professionally challenging because it requires the counselor to balance the ethical and legal obligation to obtain informed consent with the client's right to privacy and autonomy, particularly in the context of potential trauma triggers. The counselor must ensure the client understands the scope of services, confidentiality limits, and their right to refuse participation or withdraw consent, without further re-traumatizing them or coercing them into disclosure. The correct approach represents best professional practice because it prioritizes client autonomy and safety while adhering to the IC and RC ADC exam's ethical standards, which emphasize obtaining voluntary and informed consent. This involves clearly explaining the purpose of the assessment, the types of information that will be gathered, how that information will be used and protected, and the client's right to refuse to answer any question or withdraw from the assessment at any time without penalty. This process empowers the client and builds trust, which is foundational for effective treatment. An incorrect approach that involves proceeding with the assessment without fully addressing the client's concerns about disclosure or their right to refuse information would be a significant ethical failure. It violates the principle of autonomy by not respecting the client's boundaries and potentially their right to privacy. Furthermore, it could be seen as a breach of the informed consent process, as the client may not have truly understood their rights or the implications of participating. Another incorrect approach, such as pressuring the client to disclose sensitive information by implying it is necessary for treatment, constitutes coercion and disrespects the client's right to self-determination, which is a core ethical tenet. Failing to clearly explain confidentiality limits and their exceptions, especially concerning potential harm to self or others, is also a regulatory and ethical lapse, as clients must be fully aware of when their information might be shared. Professionals should employ a decision-making framework that begins with a thorough understanding of the client's presentation, including their expressed anxieties and potential vulnerabilities. This should be followed by a clear, client-centered explanation of the assessment process, emphasizing their rights and the counselor's ethical obligations. Active listening and open-ended questions are crucial to ensure the client's understanding and to address any hesitations or fears. The counselor must be prepared to adapt the assessment process, if possible, to accommodate the client's comfort level while still gathering necessary information, or to discuss alternative approaches if full participation is not feasible or advisable at that moment. Question 17. The audit findings indicate that a counselor's risk assessment process for new clients appears to be heavily influenced by their personal feelings about the client's presentation, rather than a standardized evaluation of potential risks. Which of the following approaches best aligns with professional best practices and regulatory expectations for risk assessment and management in alcohol and drug counseling? Option A. Focusing exclusively on the client's reported frequency and quantity of substance use, assuming this is the sole determinant of risk for relapse or harm. Option B. Utilizing a brief, informal conversation to assess risk, aiming to avoid overwhelming the client with questions that might create anxiety or resistance. Option C. Employing a validated risk assessment tool that considers multiple domains of functioning, including substance use history, mental health, social support, and criminogenic factors, while actively seeking supervision to ensure objectivity. Option D. Relying primarily on clinical intuition and subjective impressions of the client's demeanor to gauge their level of risk, prioritizing a positive therapeutic alliance over a formal assessment. Correct answer is C. Employing a validated risk assessment tool that considers multiple domains of functioning, including substance use history, mental health, social support, and criminogenic factors, while actively seeking supervision to ensure objectivity. Explanation. The audit findings highlight a critical challenge in risk assessment and management within an alcohol and drug counseling setting: the potential for bias to influence the evaluation of client risk. This scenario is professionally challenging because subjective interpretations can lead to inaccurate risk assessments, impacting treatment planning, resource allocation, and client safety. It requires careful judgment to ensure objectivity and adherence to established best practices and regulatory guidelines. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based, and objective method for risk assessment. This involves utilizing validated assessment tools and considering a comprehensive range of factors, including client history, current presentation, and protective factors, while actively mitigating personal biases. This aligns with the IC and RC ADC exam's emphasis on ethical practice, client-centered care, and adherence to professional standards that mandate accurate and unbiased evaluations. The goal is to ensure that treatment plans are tailored to the individual's actual risk level, promoting effective recovery and minimizing potential harm. An incorrect approach that relies solely on clinical intuition without the support of standardized tools fails to meet professional standards. This can lead to biased assessments, potentially over or underestimating risk based on personal biases or superficial observations, which is a violation of ethical principles requiring objective evaluation. Another incorrect approach that focuses exclusively on the severity of substance use, neglecting other crucial risk factors like co-occurring mental health issues or social support, results in an incomplete and potentially inaccurate risk profile. This incomplete assessment can lead to inappropriate interventions and a failure to address the full spectrum of a client's needs, contravening best practices in comprehensive care. Finally, an approach that prioritizes client comfort over accurate risk identification by downplaying potential risks to avoid causing distress is ethically unsound. While client rapport is important, it cannot supersede the professional obligation to conduct a thorough and accurate risk assessment, which is essential for client safety and effective treatment. Professionals should employ a decision-making framework that begins with recognizing the potential for bias in any assessment. This involves a commitment to using validated, standardized risk assessment instruments and protocols. The process should include a thorough review of all available client information, active self-reflection to identify and mitigate personal biases, and consultation with supervisors or peers when uncertainty exists. The ultimate goal is to arrive at an objective, evidence-based risk assessment that informs a client's individualized treatment plan, ensuring both safety and efficacy. Question 18. Implementation of cognitive behavioral therapy, CBT, for a client struggling with substance use is met with significant resistance from the client, who expresses a strong dislike for the structured exercises and homework assignments typically associated with CBT. As an alcohol and drug counselor, what is the most appropriate initial response to this situation? Option A. Immediately discontinue the use of CBT and switch to a different therapeutic modality without further investigation into the client's specific concerns or exploring potential adaptations. Option B. Insist on the client completing the standard CBT exercises as prescribed, explaining that adherence to the established protocol is essential for treatment success, regardless of their personal preferences. Option C. Proceed with the CBT sessions as planned, but avoid directly addressing the client's expressed dislike for the exercises, hoping they will eventually become more accepting over time. Option D. Engage in a collaborative discussion with the client to explore the specific reasons for their discomfort with CBT exercises and homework, and jointly problem-solve potential modifications or alternative strategies that still address underlying cognitive and behavioral patterns. The correct answer is D. Engage in a collaborative discussion with the client to explore the specific reasons for their discomfort with CBT exercises and homework, and jointly problem-solve potential modifications or alternative strategies that still address underlying cognitive and behavioral patterns. Explanation. Scenario analysis. This scenario presents a common challenge in substance use counseling where a client exhibits resistance to a core therapeutic technique. The counselor must balance the client's autonomy and therapeutic alliance with the evidence-based efficacy of cognitive behavioral therapy, CBT, for substance use disorders. The challenge lies in adapting treatment to the individual while adhering to professional standards and ethical obligations to provide effective care. Correct approach analysis. The most effective and ethically sound approach involves a collaborative discussion with the client to understand their reservations about CBT. This aligns with the principles of client-centered care and shared decision-making, which are fundamental in substance use counseling. By exploring the client's specific concerns, the counselor can address misconceptions, tailor CBT techniques to be more palatable, or explore alternative, complementary approaches that still address the underlying cognitive and behavioral patterns contributing to substance use. This respects the client's agency and strengthens the therapeutic alliance, which is crucial for treatment engagement and success, as emphasized by IC and RC ADC standards for ethical practice and effective treatment delivery. Incorrect approaches analysis. One incorrect approach would be to unilaterally dismiss the client's concerns and insist on the strict, unmodified application of CBT techniques. This disregards the client's autonomy and can damage the therapeutic relationship, leading to disengagement and treatment failure. Ethically, this violates the principle of respecting client self-determination and can be seen as a failure to provide individualized care, which is a cornerstone of effective substance use counseling under IC and RC guidelines. Another incorrect approach would be to abandon CBT entirely without further exploration or attempting modifications. While flexibility is important, completely discarding an evidence-based modality without understanding the client's specific barriers is not best practice. This could lead to a less effective treatment plan and potentially fail to address the core cognitive and behavioral issues that CBT is designed to target. This approach could be seen as a failure to provide competent care by not fully utilizing available evidence-based interventions. A third incorrect approach would be to proceed with CBT without acknowledging or addressing the client's stated discomfort. This is a passive and potentially harmful approach that ignores the client's expressed needs and feelings. It undermines the therapeutic alliance and can lead to the client feeling unheard and unsupported, ultimately hindering progress. This violates the ethical obligation to maintain an open and honest therapeutic relationship. Professional reasoning. Professionals should employ a decision-making framework that prioritizes understanding the client's perspective. This involves active listening, empathy, and a willingness to explore the rationale behind the client's resistance. The counselor should then collaboratively problem-solve, seeking to adapt the intervention or explore alternatives that align with the client's readiness and preferences while still addressing the core therapeutic goals. This iterative process of assessment, collaboration, and adaptation ensures that treatment remains client-centered, ethical, and effective. Question 19. The evaluation methodology shows that certified alcohol and drug counselor has not formally engaged in continuing education activities for over 3 years, despite working extensively with a diverse client population experiencing co-occurring disorders. The counselor states they are keeping up to date by reading articles occasionally and relying on their extensive experience. Which of the following represents the most professionally responsible course of action to ensure continued competence and adherence to ethical and regulatory standards? Option A. Actively seek out and participate in a minimum of 40 hours of approved continuing education within the next 12 months, focusing on evidence-based practices for co-occurring disorders and emerging treatment modalities, and document all activities. Option B. Focus exclusively on increasing client caseload to gain more practical experience, as this is the most direct way to enhance skills and demonstrate competence. Option C. Continue to rely on extensive experience and occasional article reading, as this has proven effective in past client outcomes, and consider attending a general conference on addiction treatment in the distant future. Option D. Delegate the responsibility of staying current on treatment modalities to supervisors or more experienced colleagues, as their knowledge can be indirectly applied. Correct answer is A. Actively seek out and participate in a minimum of 40 hours of approved continuing education within the next 12 months, focusing on evidence-based practices for co-occurring disorders and emerging treatment modalities, and document all activities. Explanation. The scenario presents a common professional challenge for alcohol and drug counselors, maintaining and updating their knowledge base in a rapidly evolving field while adhering to professional standards and ethical obligations. The core of the challenge lies in balancing the demands of direct client care with the necessity of continuous learning and skill enhancement. This requires careful judgment to prioritize activities that directly contribute to improved client outcomes and uphold professional integrity. The correct approach represents best professional practice because it directly addresses the IC and RC-ADC exam's emphasis on ongoing professional development as a cornerstone of competence. Engaging in a variety of learning activities, including formal training, peer consultation, and self-study of current research, ensures that the counselor's knowledge and skills remain current and effective. This proactive stance aligns with the ethical imperative to provide competent services and the regulatory expectation that counselors stay abreast of best practices and emerging trends in addiction treatment. Specifically, seeking out training relevant to new treatment modalities or evidence-based practices directly enhances the counselor's ability to serve diverse client needs effectively. An incorrect approach that focuses solely on administrative tasks or client caseload without dedicating time to continuing education fails to meet the professional standard of competence. This represents a regulatory and ethical failure because it risks providing outdated or suboptimal care, potentially harming clients. Relying on outdated knowledge or anecdotal experience without formal updating is a breach of the duty to provide competent services. Another incorrect approach, such as attending superficial or irrelevant training, also constitutes a failure. While it may appear to fulfill a requirement, it does not genuinely enhance professional competence and therefore does not serve the client's best interest or uphold the counselor's ethical obligations. This approach can be seen as a form of checking a box without substantive professional growth. The professional decision-making process for similar situations should involve a systematic self-assessment of current knowledge and skills, identifying areas for growth based on client needs and emerging best practices. Counselors should then actively seek out continuing education opportunities that are relevant, evidence-based, and contribute to their professional development. This process should be guided by a commitment to client welfare and adherence to professional codes of ethics and regulatory requirements for continuing education. Question 20. Investigation of a 35-year-old male client presenting with reported symptoms of insomnia, irritability, and significant cravings for alcohol, which he states have worsened over the past 2 weeks following a stressful work-related event. He also mentions experiencing occasional panic attacks, which he attributes to his current stress. He has a history of moderate alcohol use, typically on weekends, but denies any prior formal treatment for substance use or mental health issues. The counselor notes his agitated demeanor and occasional tangential speech during the initial interview. What is the most appropriate next step in the assessment and diagnostic process? Option A. Immediately diagnose the client with alcohol use disorder, moderate, based on his reported cravings and recent increase in alcohol use, and initiate a standard outpatient treatment program. Option B, focus solely on the panic attacks, assuming they are the primary driver of his distress, and refer him to a psychiatrist for medication management without further exploration of his substance use history. Option C, administer a comprehensive diagnostic interview that explores the onset, duration, and severity of all reported symptoms, including substance use patterns, mental health history, and potential triggers, while also inquiring about cultural factors influencing his presentation. Option D, conclude that his symptoms are purely stress-related due to the recent work event and advise him to focus on stress management techniques, deferring any formal substance use or mental health assessment. The correct answer is C. Administer a comprehensive diagnostic interview that explores the onset, duration, and severity of all reported symptoms, including substance use patterns, mental health history, and potential triggers, while also inquiring about cultural factors influencing his presentation. Explanation: this scenario presents a common challenge in assessment and diagnosis, where a client's presentation is complex and potentially influenced by multiple factors, including substance use, co-occurring mental health conditions, and cultural background. The professional counselor must navigate these complexities to arrive at an accurate diagnosis and develop an effective treatment plan, adhering to the IC and RC ADC exam's emphasis on comprehensive assessment and ethical practice. The correct approach involves a multifaceted assessment that integrates information from various sources and considers the client's lived experience. This aligns with best professional practice by ensuring that the diagnosis is not solely based on a single observation or self-report, but rather on a holistic understanding of the individual. This approach respects the client's autonomy and promotes a collaborative therapeutic relationship, which is crucial for successful treatment outcomes and is implicitly supported by the ethical guidelines governing alcohol and drug counseling. The IC and RC framework emphasizes the importance of accurate diagnosis for appropriate intervention. An incorrect approach would be to prematurely conclude a diagnosis based on initial symptoms without further exploration. This could lead to misdiagnosis, inappropriate treatment, and potentially harm to the client. For example, solely relying on the client's self-report of anxiety without exploring potential substance-induced anxiety or other underlying mental health conditions would be a failure to conduct a thorough assessment as expected by professional standards. Another incorrect approach would be to dismiss the client's cultural background as irrelevant to their substance use or mental health presentation. Ethical guidelines and best practices mandate cultural competence, requiring counselors to understand how cultural factors may influence a client's experiences and help-seeking behaviors. Failing to do so can result in a biased assessment and ineffective treatment. The professional decision-making process in such situations should involve a systematic approach. First, gathering comprehensive information through interviews, collateral contacts, with consent and standardized assessment tools. Second, considering differential diagnoses, including substance-induced disorders and co-occurring mental health conditions. Third, integrating cultural considerations into the assessment. And fourth, formulating a diagnosis that is supported by the evidence and collaboratively discussed with the client. This iterative process ensures that the assessment is thorough, accurate, and client-centered.